people who are mentally ill, who are not homeless, but they are in our various local communities, can now have access to mental health.
I think we should talk about some of the amazing work that Amudo has actually done, right? Amudo has successfully rehabilitated over 1,200 mentally ill and homeless individuals with their families. And is that something you can talk more about and give more context to so people can get a sense?
Yeah, we have rehabilitated um, that number and even beyond. What it means is that each year, Amudo focuses in taking off the streets up to 40 people who are mentally ill and homeless. And you know what it means to bring such people in and take care of them, as I have earlier stated. And at random, you will discover that with that number that is coming in and the number that may be left at the center, which we have a capacity of about 68 people or 65, so we will be able to attend to their needs. And sometimes we have 20, 25 people becoming mentally stable within the year, and they are, reunited with their families. And since 1989 up to date, that's the number Amudo have rehabilitated. And this rehabilitation, like I said before, is quite challenging because you have to trace the homes of all these people. There is no rehabilitation that is complete without reunion with family and relatives.
Hmm.
So if you are doing rehabilitation and you are not planning to get that person back to family and that is not rehabilitation. And so when you are when you bring somebody in, from day one you begin to plan for how that person will go back home, from the street to Amudo, back to the person's home. And that is what we have done. And you can imagine what it means to transverse and travel across Nigeria, you know, from one rural community of Nigeria. Sometimes bad roads, sometimes vehicles break down, sometimes there are cases we go and we come back when the person may have made a mistake on the address. Patiently we come back and continue until when we finally get it right. So that is it. Sometimes you go and families try to reject. We come back and plan again. Oftentimes we use the mechanism of the community, the traditional rulers, and engage the family, and there is that acceptance. So it's not really an easy thing, but it's quite a great impact that this number of people, if they have been on the streets, imagine that number that are mentally ill and homeless roaming our streets. You know what that could have been. And what that means is that Amudu have been able to help them to get back to their family, get their dignity back, and of course, live meaningful life. There are a lot of them that are back to school. We have a person we have rehabilitated who is practicing now as a lawyer. You know, some are married with families. Of course. So there are teachers that have been rehabilitated. There are traders that have been rehabilitated. I mean, it's just about it. And that what it's demonstrating is that by taking these people back home, is to disabuse those wrong beliefs that somebody who has a mental health problem because he's on the street cannot be treated.
Yeah, that's Amudo has also directly impacted the life of over 5,000 individuals in the southeast of Nigeria. Can you talk about how these individuals has impacted from this much needed support that they've received from Amudo clinics? And can you discuss like the partnership and collaboration involved in making this program a success?
Yeah, as the rehabilitation center started at the center there at Itumbauzo in Bend, the local government area of Abia State, the number of those who were being rehabilitated began to increase. So the issue is now continuity of care. What do you do about it? So that was why Amudo had to leverage on the inclusion of mental health as a primary health care, in the by the federal government. Now we have to partner with the government of Abia State to roll out the community mental health program. The community mental health program is designed as a partnership with the state government to establish or open community mental health clinics within the local government areas. In this case, in Abia State, 17 local government areas, so that in case those who have been rehabilitated from their various local government areas can have access to mental health care when they have gone back to their communities. And then instead of coming to the center, they will now go back to those clinics to continue to receive service. So the state government post the psychiatric nurses to those clinics. Amaudo supply the psychotropic drugs and supervise the activities of the psychiatric nurses so that they will be in the best practice for the good of this person who has a mental health problem. Now, the clinic is not just designed for these ones who are going back, it's also designed that people who are mentally ill, who are not homeless, but they are in our various local communities, can now have access to mental health care. So the brainchild of the community mental health is for access and affordable mental health care, because at those clinics the nurses are not allowed to charge them cost of consultation. They are not allowed to charge because they are being paid by the state government. And now Amaudo supply every basic instrument, syringes, instrument for blood pressure, gloves, and the medicine. So you don't charge anybody because you say go and buy a syringe. So because of the only thing that the family have to do is that they have to pay for the medication, and the cost of the medication is not by profiteering, it's just the cost of that drug. So what Amaudo does is to monitor the activities of the psychiatric nurse, and we go to their families of these people to find out how are you doing, when last did you visit the clinic, and we collect report from the nurses to find out who visited the clinic and why didn't the person visit the clinic at this particular month, and we try to find out why did it happen. And in doing that, we try to encourage and strengthen the families and try to find out if there is any issue, and of course to close the gap that there will be no relapse. So apart from those who have been rehabilitated, over 5,000 people from various communities in Abia State are accessing services from the community mental health clinics in the various local governments. It is not only in Abia State. We have moved further to open community mental health clinics in Imo State in the same pattern of partnership, in Ebonyi State in the same pattern of partnership, and in Anambra State. If you look at the presentation there, it was the then governor of Anambra State, Mr. P2B, that was flagging off, the community mental health in Anambra State. And we also provide motorcycle for the nurses to be able to visit some of the clients in their homes, because there are some of them that may not be able to move from their house to the clinic. So the psychiatric nurses could be able to reach out to them in their local places and plan with the family on the best way to continue to give them support. And this has worked very well. And this started since 1992. Since 1992, we have continued in this. Now, the challenge of this is that there are psychiatric nurses who are retiring, and we're encouraging the government to train more psychiatric nurses, encourage nurses to be trained, because if those who have been trained, that some of them are nearing retirement age, that they retire, we don't have a new workforce of psychiatric nurses, it will affect. And that is why you know that the Federal Neuropsychiatric Hospital in Southeast, located in Enugu, is the only regional psychiatric hospital by the federal government for psychiatric cases. Now imagine what it will take for this population who will be traveling, to Enugu, just because they have depression, just because they have bipolar, just because they have schizophrenia. You know how costly it will be. And because if there is no service that is closing this treatment gap that as Amaudo have provided, a good number of our people will now have mental health problems. It's either they are locked up by their families or they find themselves back to the streets because of no. So Amaudo, by this design, is closing the treatment gap in mental health in Nigeria.